Ladies and gentlemen, thank you for standing by. Welcome to the NCD Alliance webinar. During the presentation, all participants will be in a listen-only mode. Should you wish to ask a question during the presentation, please use the chat feature located in the lower left-hand corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Wednesday, September 9th, 2015. I would now like to turn the conference over to Dain, Executive Director of the NCD Alliance. Please go ahead.
Thank you very much, and good morning, good afternoon, or good evening, everybody. Welcome to this NCD Alliance webinar. We have a very packed agenda today to talk you through lots of different elements that have been happening over the summer months. It's hardly been a quiet summer, I would say, with lots of different things going on, particularly obviously in the lead up to the UN Summit on Sustainable Development that's happening this September. So in terms of who we have speaking today, we have Priya Kanayson from the NCD Alliance in New York, we have Alena Matzke from the NCD Alliance based in Geneva, and we have Jess Beagley from the NCD Alliance based here in London with me. In terms of what we're going to be focusing on today on the webinar, we will firstly be providing you with an update on the Global Development Campaign, particularly focusing on the post-2015 processes, particularly the indicators in that regard. And also talking about preparations for the UN Summit, Sustainable Development Summit that's happening in a couple of weeks in New York. Secondly, we'll be providing you an update on our preparations for the Global NCD Alliance Forum, and within that, we'll be particularly updating you on the EMRO regional meeting that has just taken place in Cairo just last week. And then finally, we will be sharing an update on the Global NCD Framework Campaign, which will focus this time around on the Global Coordination Mechanism activities and also the upcoming regional committee meetings of WHO, which are starting just in a week or so as well. So with that introduction, I would like to pass over to Priya to talk us through the Global Development Campaign. Priya.
Thanks very much, Katie. So as Katie said, quite a bit has been happening this summer around global development. What I'll go through today is an update on the post-2015 indicator development process and also preparations for the UN Sustainable Development Summit, which is coming up in just 2 weeks or so. Next slide, please. So the indicators for the Sustainable Development Goals are, we are now almost towards the end of the consultation process to develop the Global Indicator Framework. The first open consultation process closed this Monday, and the Interagency Expert Group on the SDGs, IAEG-SDGs, will be taking all inputs received to revise the framework and produce an updated proposal by the 21st of September. They will then open up another consultation process, which will close on the 15th of October, based on this updated list that has taken into consideration all inputs received from the first consultation. After the 15th October deadline, they will again revise the indicator framework, and it will then be taken to the second meeting of the expert group, which will be held in Bangkok from the 26th to 28th of October. The expert group will discuss the proposed indicator framework and finalize a framework to submit to the 47th session of the UN Statistical Commission, the UNSC, by the 30th of November. Between the 30th of November and March of 2016, the UNSC will be reviewing the Global Indicator Framework, and it will then be finalized and adopted by the UNSC in March of 2016 when they meet, and it will later be adopted by ECOSOC and the UN General Assembly. So some important documents at the bottom of the page that you can see there are links to the main website of the IAEG SDGs, which further details this process, the consultation process and the entire development process for the Global Indicator Framework. And it also provides links to the consultations and the inputs received during those consultations for your review. So it enables you to see how the process has moved along since it began. It also provides a link to the updated list of priority indicators. This was the link that we provided comments to, which I will go into shortly. Next slide, please. So why is this important? For several reasons. While we have secured an NCD target in the post-2015 agenda, our work is far from over. Ensuring technically sound indicators that accurately measure progress are essential to holding member states accountable and to ensure progress is being made not only for NCDs but also NCD-related targets. So as you can see here, we have just a few reasons why the NCD community and the health community at large should be involved in this indicator development process. As I said, accountability, ensuring health in all policies, which really demonstrates how NCDs are integrated across and throughout the entire sustainable development agenda, and ensure governments are making progress towards reaching target 3.4 on NCDs. Also evidence on progress and on how multi-sectoral, multi-stakeholder partnerships can be utilized, which will be essential for achieving the post-2015 agenda. And finally, visibility. Next slide, please. So as I mentioned before, the NCD Alliance held a consultation process with our network to gather feedback and recommendations on the proposed global indicators. What we have here are the current proposed indicators for the NCD targets, so Target 3.4 and the Target 3A on the Framework Convention for Tobacco Control. In addition to providing comments on Target 3.4, the collective submission, which we submitted on Monday to the consultation process, included proposals for targets under several other health-related targets. So I'll go into that in just a second. So for Target 3.4, our main proposal was that we suggested that the IAEG align the NCD targets with the NCD indicators with existing indicators in the WHO Global Monitoring Framework, and that's to ensure coherency across this global development agenda. So some of the other proposed indicators were under Target 2.2 on nutrition, where we proposed capturing prevalence of overweight and obesity amongst children, adolescents, and also adults. Target 3.9 on air pollution, where we proposed to measure mean air pollution of particulate matter. Target 7.1 on energy, which we suggested measuring percentage of households using clean and efficient cooking fuels, and Target 11.2 on transportation, where there we suggested the proportion of population using bicycling, walking, and public transportation. So a full list of all the targets we commented on will be available shortly, and it also details the rationale for why the NCD community was commenting on these targets, which may at first not seem to be related to NCDs. Next target, please. Next slide. So this is a snapshot of our consultation process and where we started and where we are now. So this indicator development process really began in January, where the UN Statistical Commission started putting out proposed indicators, and the entire community started discussing this. So we had an initial NCD Alliance Network consultation where we reached out to all of our members and experts and put together a table, which many of you have seen, with proposed indicators for NCD-related targets. So this is not only for Target 3.4, as I said, but for many of the other health-related and non-health targets and goals. So that led us to August, which just recently passed, the consultation based on the proposed indicators from the list that was released on the 11th of August. And that resulted in the collective NCD community submission to the IAEG SDGs, which the process ended on Monday. So now moving forward, we will be on the lookout for the next proposed framework, which will be released on the 21st of September, and we will continue to input in the same collective consultation that we have undergone so far to ensure that we have a collective NCD community response to input into this global indicator development process. And so the deadline for that, again, is the 15th of October. Next slide. So moving right along into the UN Sustainable Development Summit, which is what we all have our eyes on right now. It will be held from the 25th to the 27th of September in just 2 weeks or so, 2.5. Again, heads of state, heads of government, ministers, civil society, and all will be in attendance. And the chart there is the official schedule. So the opening of the session is on Tuesday the 15th, but the summit itself begins the 25th. So it runs Friday, Saturday, Sunday, and during that summit there will be 6 interactive dialogues, plenary meetings, and the outcome will be the adoption of the post-2015 development agenda, which is now being referred to as the 2030 agenda. And a link to that agenda is on that slide. And then after the close of the summit on the Sunday, the general debate of the 70th session will begin on Monday, the 28th of September, and run through Tuesday, the 6th of October. Next slide, please. So the main meat of the Sustainable Development Summit during those 3 days are 6 interactive dialogues. The overarching theme is transforming the world, realizing the post-2015 development agenda. While health is not its own particular dialogue, it is addressed under Dialogue 2, which is tackling inequalities, empowering women and girls, and leaving no one behind. Each of the dialogues has 2 co-chairs, and for Dialogue 2, which addresses health, the President of Kenya and the President of Croatia will co-chair the dialogue. This dialogue, Dialogue 2, will be held on the afternoon of Friday, September 25th. Next slide, please. Civil society participation during the summit. So registration is now closed due to extremely high demand, but all sessions will be webcast, and the link for the webcast is on the slide there. So security around UN headquarters during this time in New York is very tight and access is limited. Many of the roads are blocked off. So for side events that are held within that blocked off area at UN headquarters, the event organizers will contact registered attendees with information about picking up special events tickets and security protocols, which is why it's essential that if there are events that you would like to attend, you make sure to register for those. So including side events, 24 civil society speakers were selected to speak during the summit, and this will be during each of the 6 dialogues. They have about 2 to 3 speakers, and also during the plenary. So for Dialogue 2, we have Ms. Diamond from the International Disability Alliance who will be speaking then, and then Ms. Beals from Help Age International who will speak during the plenary, but the date and time is to be confirmed. So a link, if you would like to look at all the 24 speakers who were chosen to speak and their organizations, is provided for you there on the slide. Next slide, please. So moving into the summit, we of course have several key advocacy messages. Here's a snapshot of some of the key messages that we have developed going into this year's General Assembly. So accountability, strong accountability mechanisms, effective implementation and achievement of the SDGs and targets will really rely on the ability to monitor and review commitments and hold governments accountable. Part of this includes technically sound indicators, as I mentioned before, that accurately measure progress. And that's really an area where civil society can and should be involved, whether it be providing technical expertise, helping with capacity building, and as a resource. So one of the hallmark achievements of the 2030 Agenda is the interlinked nature of all goals and targets. The co-facilitators during the development of the 2030 Agenda really tried to drive home the notion that sustainable development cannot be achieved unless all goals and targets are met for all. So doing so involves a transformative, multi-sectoral and multi-stakeholder approach, which will result in multiple mutual benefits and really move us out of siloed approaches to a more horizontal approach to development. Additionally, securing the financial resources necessary to achieve the 2030 Agenda will involve adequate domestic resources, sustained adequate domestic resources, continued official development assistance, and private sector involvement. So a more detailed advocacy brief is forthcoming and will be available at the link below on this slide. And we strongly urge you to use the messages laid out here and in the brief as you speak to partners in advance of and during the General Assembly to really drive home this message. Next slide, please. So the NCD Alliance is hosting its side event on Saturday, the 26th of September during lunchtime from 1:15 to 2:45. The title is Translating the Post-2015 Agenda, Action on NCDs for a Sustainable Future. So how do we take this target that we have achieved and make it a reality? So we aim to discuss the interlinkages between NCDs and broader sustainable development priorities. We focus on the different approaches and responses necessary to involve health and other sectors, and also the financial investments needed to drive the actions. So there's an RSVP link on the slide, and we urge you all to attend. Next slide, please. Here we've laid out a few of the other NCD-related and health-related side events. This is by no means a full view of everything that is happening. For a fuller calendar of events, there's a link at the bottom of the page, which is the current version that we have. So there are a few here that we've chosen to snapshot. Beginning on Monday, the 21st of September, which is before the summit actually begins. There's an evening event on universal health coverage. On the Thursday then, the 24th, the day before the summit begins, another UHC event in the morning, and in the afternoon, a young people event on SDG targets and the AIDS epidemic. On Friday, there's quite a lot happening in addition to the summit opening and Dialogue 2, which will address health. The Health and Post-2015 NGO group, which the NCD Alliance has been very active in and also played a leading role. There will be a strategy meeting in the afternoon, and that is invite only, but we can provide further information if you contact us. There will also be another afternoon to early evening UHC event, and in the evening, two concurrent events, one for people with disabilities, Imagine 2030, and also Women in SDGs, Why NCDs Matter. So for more information, of course, I would urge you to visit the full calendar of events and the RSVP links. Next slide, please. Here are a few more events that are happening, and again, by no means is this a full snapshot of everything that's happening. On Saturday, in the morning, there's an accountability among health sectors, and this is hosted by PMNCH, NCD Alliance, and several other organizations. The NCD Alliance event is, of course, happening on the Saturday, and in the afternoon, an event on healthcare and water and sanitation and hygiene. On Monday, the 28th, there's an NCD Child event on the SDGs and NCDs. Again, that one is invite only, but we could happily provide further information if you're interested. And Tuesday in the evening, launch of the RHD Action Movement. So RSVP information is included, and there's further information in the link below. If you know of any other events you think should be included in the calendar, please forward us the relevant information, and we will include it and be posting the full calendar on our website. Next slide, please. So finally, in preparation for the summit, we urge all those who are attending, or even if you're not able to make it, to contact country delegations who will be attending the General Assembly and the summit to encourage them to include NCD statements on NCDs in their head of state, head of government statements. In order to do so, we urge you to utilize the UNGA advocacy brief that will be coming soon and posted on our website, as well as our communication strategy, which is also coming soon. And of course, follow the indicator process. We will be communicating further with our network about that after the 21st of September, when the updated proposed indicator framework is released. And please, as always, inform us of your planned activities by email, which is listed there for your convenience, and any other events that you know of happening during the General Assembly. Over to you, Katie.
Excellent. Thank you very much, Priya, for that really comprehensive presentation. We'll have a few questions at this point before we move on to our next agenda item. We've had a question through from Bryony from WCRF. Do we know which specific day during the summit the actual agenda will be adopted?
Thanks for that. We actually do not have a clear indication of when that will be. Sometimes they adopt it at the beginning and then proceed with all the statements, and sometimes at the end. I think that will be something we'll be advised of closer to the day. So sorry to not be able to provide a definite answer on that just yet.
Okay, great. Thank you. I have a question, Priya. You mentioned obviously that there's quite a lot of restrictions in terms of access to the summit itself. So civil society that haven't registered already won't be able to access the main UN building. But for those that have registered, do you think it will be worthwhile going into the UN sessions and listening to the plenaries and the round tables?
I think it could be helpful if that is something that the individual is interested in. A lot of the side events are happening concurrently, so a lot of the meat of the summit may be occurring during these side events. There's a wealth of information during the side events, and also the webcast is happening and for each of the sessions, the plenary and the dialogues. So that is also another way for people who are not registered and even for those who are to get in, because security, I think we should anticipate very long lines and crowds to get in.
Okay, great. Thank you. There are no more questions at this point, so let's move on to our next agenda item. Thank you very much, Priya, for that excellent presentation. Our next agenda item is the Global NCD Alliance Forum and an update on the regional preparatory meetings that we're holding in the lead up to the forum in November. So over to Alena for a presentation on the Global Forum.
Great. Welcome, everybody. Good morning or good afternoon, depending on where you find yourself. So I'll be giving a short update on the regional preparatory meetings that we are holding the lead up to the Global Forum, which is taking place in November in the United Arab Emirates in Sharjah. As a brief reminder, the objectives of the regional preparatory meetings that we have been holding in the past couple of months were really around the sharing of experiences, challenges, lessons learned, and best practices of civil society organizations in the different WHO regions. To stimulate a multi-sectoral approach to NCD prevention and control by fostering collaborations between civil society organizations and other key NCD stakeholders in the respective regions, to explore, nurture, and support national and regional alliances that are in the early stages of coming together, and then to identify the respective regions' specific capacity building needs, and all of these objectives really serve to produce input for the Global Forum, for us to really build our capacity building initiatives around input directly from the region, as well as obviously to accelerate the civil society response in the different regions. So the meetings that have taken place so far were in the Caribbean on the 6th of June. The meeting took place in Barbados. In Latin America, civil society organizations met just a couple of days later in Panama. For the Southeast Asia region, the meeting took place in July in Delhi in India. And then last week, the Eastern Mediterranean region convened at WHO, at the WHO regional office in Cairo in Egypt on the 1st and the 2nd of September. And we have further meetings planned for Afro coming up on the 2nd and the 3rd of October, and this meeting will take place in Nairobi in Kenya. And then also for the Euro region, which is on the 19th and 20th of October in Brussels in Belgium. And then we're also exploring a meeting for the Western Pacific region with the WHO regional office for next year. So after the forum, we won't be able to hold a meeting before the forum anymore, and we're looking into a date in spring. Next slide, please. So in this update, I will be focusing on the meeting that took place in Cairo last week. We had a total of 52 participants, including 37 representatives from CSOs from 12 of the Eastern Mediterranean countries. The region is a very large region, so this represents representatives from approximately half of the countries in the EMR. And additional participants included the NCD Alliance, WHO country and regional staff, mostly regional staff, as well as also a regional representative from the UN Development Program. And as said before, the main aim for this meeting was to strengthen the civil society movement in the region by facilitating the sharing of experience and best practice, review the current capacity of civil society organizations, and also really to foster alliances both at the national and the regional level. And the meeting was opened by the regional director, Dr. Ala Alwan, and included also an opening speech by Her Royal Highness Princess Dina Murad of Jordan, who's been a champion for NCDs ever since the high-level meeting in 2011. And it was quite notable that the regional director himself actually stayed or attended the entire first day of the meeting, and then also joined the closing session on day two. And given that regional directors tend to be very busy, giving an entire day of his time was quite a significant gesture of his commitment to strengthen NCD civil society in the region. In preparation for the meeting, we commissioned a background paper mapping civil society organizations across the region, and I'll come back to this point in a second. On this slide included is a link where you can read and where you can access and read the background paper in more detail. The meeting itself identified civil society priorities for joint follow-up and action, and really built quite a significant momentum for the establishment of a regional NCD alliance as well as alliances at the national level. So after day one, overnight, we were made aware that a national alliance had been formed in Saudi Arabia to be followed up on, of course, but that was quite exciting news to see such enthusiasm at the meeting. And again, another link here on this slide, which leads you to a news story on the WHO EMRO website, including a short video message by Her Royal Highness that was recorded during the meeting. Next slide, please. So I'll be going into a bit more detail on the background paper. It will be a very limited snapshot, and I encourage you to read the background paper. We also did a background paper for Southeast Asia, which you can also find on our website. So there's and it's quite interesting to see how the regions differ, but also are quite similar in many ways. We based the background paper on both an online survey and key informant interviews. We had quite a short time frame to turn this paper around, so there's obvious limitations in terms of the sample size. We had a total of a bit more than 50 responses, but 47 that we could use. And these responses to the survey came from participants of the meeting, from members of the NCD Alliance federations, but also from via the civil society lists of the different NCD programs of the WHO country offices in the region, and then the interviews or the key informants covered each major NCD and risk factors, including Alzheimer's disease, and the aim here was to cover as many countries in the region as possible, and we had a total of 8 interviews that fed into the background paper. So over half of the respondents were from health NGOs. This is slightly less than in the Southeast Asia region, and a considerable proportion of the total respondents, namely 25%, were from NGOs with a non-health focus, so spanning humanitarian issues, education, and development issues more broadly. And again, this is slightly more than in the Southeast Asia region, which already had quite a considerable portion of their the survey respondents coming from non-health NGOs. And then the third main group was organizations working on research. Next slide, please. So in terms of the priority audience identified by respondents, it was definitely the public as the primary target audience, followed by governments and NCD affected groups. And this focus on the general public was really an early indication in our evaluation of the data. We received that there was quite a strong focus on prevention and awareness raising among civil society organizations in the Eastern Mediterranean region. Next slide, please. In terms of the focus of the work of, in terms of the main NCD issues, survey respondents identified as a main focus in their work, tobacco control was the most common with 55%, and then followed closely by cancer, unhealthy diets, and physical activity. And perhaps not surprisingly, harmful use of alcohol was less of a priority, given that given the predominance of Islam in the region. And again, this sort of input led us to believe that there was quite a significant focus on risk factors for many of the civil society organizations working on NCDs in the Eastern Mediterranean. Other issues mentioned were also universal health coverage, outdoor air pollution, obesity, and organ failure. Next slide, please. In terms of the priority focus of interventions identified by survey respondents, about 30% of organizations work focused on raising awareness as the primary means by which they address NCDs, followed by those working on reducing exposure to risk factors, and then as a third priority, early diagnosis. And a significant number of respondents also noted health system strengthening as a priority area. Next slide, please. So in terms of the main limitations in the civil society response in the region to date, the main gaps identified by respondents were really around financial constraints, but followed very closely by the lack of a coordinated response among civil society. Then also the lack of continuity in the civil society response and limited political support for civil society in general in the region. And so we asked what the potential solutions could be to address these limitations. And on the graph here on the slide, you can see that not surprisingly, joint strategic planning by NGOs was identified as the most common solution by respondents, followed by capacity building of NGOs, integration of NCDs into existing programs, and then also coalition building. And really all of the regional organizations that responded to the survey identified joint strategic planning as an important solution, which correlates with the previously identified need for more coordination at the regional level. Next slide, please. The main capacity needs identified by respondents include good practices to reduce exposure to NCD risk factors, reflecting again the region's focus on prevention, and then other needs were advocacy and campaign skills, as well as strategy and campaign planning support, followed closely by good governance and organization building. Next slide, please. In terms of priorities for joint action at the regional level, the strategies to address cross-border promotion, taxation, and trade of tobacco, alcohol, and healthy food were by far the most frequent primary priority of respondents, followed by capacity building of NGOs, and across all three top priorities, strategies to address cross-border promotion and networking among NGOs in the region were both identified as high priorities, followed by research and surveillance and monitoring of NCD commitments by governments and capacity building of NGOs. Next slide, please. All right, so the implications for civil society in the region highlighted in the paper were really around building multi-sectoral coalitions across NCD civil society at the national level, the establishment of regional platforms for networking, information sharing, and advocacy support, particularly on transporter issues. And then also another point that I haven't really gone into any detail on, but a lot of what we saw from the survey, but also from the interviews, was really that a lot of the respondents emphasized that we should really learn from the tobacco control movement in the region, which has been quite strong. As focus areas for actions really around supporting governments in the development and implementation of national NCD plans and policies, monitoring progress and holding governments accountable, with the caveat that the particular political realities in the region make it rather difficult for civil society to play a very direct role in holding governments accountable, and then to advocate for integration of NCDs in development plans. Next slide, please. Okay, the meeting outcomes. In terms of the meeting outcomes, there will be a formal report available next week, and this report will include recommendations for civil society, for the WHO regional office, for governments, as well as the NCD Alliance. I'm just going to give you a short snapshot of what these recommendations that were made at the meeting include. So WHO, EMRO, and the NCD Alliance really committed themselves to support civil society capacity building activities, in particular trainings and workshops in the region, and it was really encouraging to see a very strong commitment here from the WHO regional office to collaborate with the NCD Alliance in offering these workshops and moving rather quickly on doing so. Meeting participants, as I said earlier, there's a lot of momentum around establishing a regional alliance as well as national alliances, with the support from WHO and the NCD Alliance. WHO will conduct a comprehensive mapping of EMRO NCD civil societies and make available and keep up to date a database of civil societies working on NCDs, civil society organizations working on NCDs in the region. And there was a lot of call for WHO to ensure that NCD civil society are engaged to a greater extent in projects and programs at national and regional level. Okay, so this is it so far for me on the EMRO regional meetings, and I'll hand over to Jessica, who will give an update on the regional committee meetings.
Thank you, Alena. I think we'll just pause there just briefly for any questions regarding the EMRO regional meeting before going to Jess to talk about the WHO regional committee meetings. We haven't received any questions, but let me just ask you a couple, Alena, because I think it's a really important meeting for a number of reasons. Number one is that this is the first time that the similar case to the WHO Sierra meeting, this is the first time that the WHO regional office has actually convened civil society in the NCD space on their own, because obviously we're very accustomed to having civil society being invited to meetings with governments, with WHO, but this was purely for civil society, which I think is a really important point to just kind of re-emphasise. I was just wondering, I mean, I was there and I thought it was a fantastic meeting. One of the themes that I think is quite interesting within the EMRO region particularly is around NCDs and humanitarian responses, obviously because of the unique challenges of the EMRO region with both conflict and refugee crises. The provision of NCD prevention and treatment services to people in humanitarian context, I think, is really important. Did that theme come out much during the meeting?
Yes, indeed, that meeting came up quite a bit, both from the side of participants. We had the Red Crescent as a meeting participant attending the meeting and very actively engaging. There was also HelpAge, who have programs in Lebanon and in Jordan that focus very much on Syrian refugees and the problems or the large burden of NCDs among these populations, and there was certainly a very keen interest from the WHO regional office to collaborate more with the NCD Alliance on advocacy around these issues. So definitely a very strong focus. I'm not doing all of the participants justice right now. There were definitely more organizations apart from HelpAge and the Red Crescent Society that actually worked quite specifically on humanitarian issues and NCDs.
Great, thank you. Just one other question from my side. As you mentioned at the beginning of your presentation, this is the fourth regional meeting that we're holding in the lead up to the forum. Can you just talk a little bit about how all of these regional meetings are informing and inputting into the global forum itself?
Yes, so I think the purpose of these meetings is really twofold. So on the one hand, they're important by themselves because they really bring together civil society organizations across the regions and building momentum around the establishment of national and regional alliances and really allowing the regions to come together around joint priorities for concerted action by civil society in the specific region. And then what we've been doing at these meetings is to engage participants in a number of exercises with the view to identify specific capacity building needs, but as well as to identify regional priorities in support of the WHO regional frameworks and plans on NCDs, and all of this input is being documented and will then directly inform our deliberations at the global forum. So really very pleased to see these background papers for all of these meetings, and then as well the specific meeting reports with very specific recommendations for capacity building needs, or for how to address capacity building needs within each of the regions, and then also the different priorities identified in the different regions for follow-up.
Great, thanks, Alena. And then we've had one question through. Was there a discussion at the meeting on stronger civil society involvement in North Africa specifically?
It's a good question. I do not recall a specific discussion on North Africa. I think there was, the discussions on stronger society involvement really were about the entire region, and I don't remember North Africa being singled out. Definitely some of the representatives from Morocco, for example, etc., highlighted their particular challenges. But unless Katie, you remember this differently, but I don't recall a very specific discussion on North Africa.
Yeah, I would tend to agree with you. It was very much a regional meeting crossing the Eastern Mediterranean and North Africa. So it was a kind of a broader discussion as a whole. But as you say, there were representatives from North African countries such as Sudan and Morocco. Okay, excellent. Thank you, Alena. We have no further questions on the EMRO meeting. Just to say that I would really encourage everybody to have a look at the background paper that Alena has just presented, and it can be found on the NCD Alliance website, and also to really look out for the official report that will be available next week, which, as always, will be circulating within one of our e-alerts, and then we'll be uploading it onto our website as well. Great. Okay, so let's move on to the next agenda item, which is WHO Regional Committee meetings. I'll pass over to Jess.
Hi, everybody. Thanks for staying with us until now. So I'm going to talk briefly on the WHO Regional Committee meetings. And the Regional Committee meetings really offer a space for member states to discuss the implementation of global commitments at the regional and national levels. So last year they were very much focused on the global NCD framework and the UN NCD review, and this year it's geared towards health, including NCDs in post-2015. And you can see on this slide a list of the dates of the different regional committee meetings, and Sierra is ongoing this week, and Euro will be up next, followed by PAHO at the end of September, EMRO at the start of October, WIPRO in mid-October, and AFRO was originally due to take place at the end of August into September, but has now been postponed, most likely till November, and details are to be confirmed. And you can see at the bottom of the page there a link to the NCD Alliance webpage on the regional committee meetings, and we'll be uploading information there as the meetings take place. So next, just brief introduction to relevant agenda items at the different regional committee meetings. So at Sierra, there's a focus on post-2015 cancer prevention and control, the implementation of FCTC, UHC with a particular focus on patient safety, and engagement with non-state actors. And actually on Monday, the Dili Declaration was adopted for tobacco control and signed by health ministers from 11 countries. And the Sierra region actually accounts for a third of the world's global tobacco use, and Sierra is home to 90% of the world's smokeless tobacco users, so that's a particular issue in that region. At Euro, there's an agenda item on health and sustainable development, physical activity, which is particularly interesting as the first ever regional physical activity strategy to be being presented, and that's for 2016 to 2025. And 36% of adults in Euro are insufficiently active, and over 65% are inactive in some member states in the region. Other items are tobacco control, social determinants of health, which of course also apply very much to NCDs in particular, environment and health, and WHO reform. PAHO has got a very specific focus on dementia in older persons and chronic kidney disease in agricultural communities in Central America. So calling all specialists in that. Also be discussing FCTC implementation, workers' health, WHO reform, and road safety. And for EMRO, it's discussion on implementation of the UN Political Declaration on NCDs, transition from MDGs to SDGs. So obviously NCDs weren't included in the MDGs, but feature very strongly in the SDGs, so that's interesting. Mental health care, UHC, WHO reform, and health and the environment. WIPRO is NCD prevention and control, aging and health, obviously, again, very relevant to NCDs, universal health coverage and urban health. And for AFRO, there aren't any NCD specific agenda items, but they will be discussing post-2015 health promotion and the determinants of health. And in terms of what the NCD Alliance will be doing around the WHO regional committee meetings, we're coordinating representation across the NCD community. We've produced an advocacy briefing which covers health in post-2015, global action on NCDs and monitoring processes, which covers the implementation of the Global Action Plan on NCDs and follow-up to time-bound commitments in the 2014 UN Review Outcome Document. And there's also a paragraph in the briefing document on the regional meetings for the Global Forum, like the EMRO meeting that Alena just discussed, and the NCD Alliance position on the WHO framework for engagement of non-state actors. We're drafting statements and submitting them to the different regional committee meetings tailored to the specific agenda items up for discussion. And as the regional committee meetings progress, we're going to track discussions and key outcomes, and we'll be sharing summaries of those as information becomes available. But at this stage, I'd really encourage you to email us at info@ncdalliance.org if you'll be attending any of the regional committee meetings, because we'd love to hear from you. Thank you very much, and I'm going to pass back to you now, Alena.
All right, so I'll provide you with a brief update on the Global Coordination Mechanism on NCDs. Next slide, please. I'll start with the working groups. So the GCM, as you all know, currently has two working groups, one working on financing for NCDs and one working on the engagement of private sector in the NCD response. And these working groups have been working throughout the year and published their interim reports this summer. And these reports were open, or are actually still open, for public consultation. The NCD submitted a response to the working group on financing interim report. The deadline was the 31st of August, but I believe it has been extended to the 15th of September, as the WHO website seems to be saying that. So if you haven't provided any comments but wish to do so still, you still have time until Monday to do so. Our submission is available via the link posted here on this slide, and we're focusing in our submission on several points. So the first is really based on the observation that the recommendations contained so far within the report do definitely reflect important initial steps towards increasing global and national resources for NCDs. However, we do believe that the working group members really need to further develop these initial recommendations to be far more specific in order to compel concrete action. So far, they seem far too broad and vague for us to foresee any real action to come out as a response to this report. We are also proposing that working group members develop a matrix of financing options for member states in order to really offer a practical, stepwise approach to scaling up resources for NCDs according to the different income levels at countries. So it's sort of a matrix tailored to the different realities at the country level, and something that member states can take forward in a very practical manner. In addition to the 5 recommendations that are currently proposed by the report, we propose an additional recommendation to improve tracking and evaluation of resources for NCDs, including domestic resources, overseas development assistance, and investments and contributions from civil society, the private sector, and philanthropies. We also, quite importantly so, call for the inclusion of the final report of the working group into the formal reporting to the 69th World Health Assembly via the 138th session of the WHO Executive Board, to ensure that member states take further action on the report at the Assembly. That leads me to sort of next steps. So the working groups will consider the input received on the interim report in a third meeting in September. And then a final report, as I understand, is foreseen to go to the WHO Director General in December. The WHO Director General, however, has no obligation to share these reports with the WHO Executive Board or the World Health Assembly, and the timing of the submission of the report is quite late also, so it will be quite difficult to still get the report into the reporting of into the documents that will go into the WHO Executive Board. So there's different scenarios here to make sure that the report is still considered by the WHO Executive Board. One such scenario could be that member states call for the establishment of a working group at the Executive Board session in January, and then request the inclusion of the report into the reporting towards the World Health Assembly. So this is an important point to bring up, both with if you know working group members on this working group, or also any of your country contacts. When you reach out to them ahead of the Executive Board, bring to their attention this final report of the financing working group, and then also encourage them to ensure that the report is being taken up at the World Health Assembly. A very brief update on the second working group. The interim report is still open for consultations until Monday, and we are in the process of developing submission. We've received a lot of input from the network, so thank you for everyone who's reached out and shared comments with us, and we'll share our submission once it's finalized past the deadline on Monday. Next slide, please. The second update on the GCM is on the next GCM dialogue, which will take place on the 30th of November and the 1st of December. The theme of this dialogue is how to strengthen international cooperation on the prevention and control of NCDs through north-south, south-south, and triangular cooperation. And you can find the background documents as well as an online registration form if you follow the links included on this slide. And as part of the format of the dialogue this time, WHO reached out to different stakeholder groups, including the NCD Alliance, to convene a pre-meeting on the 29th of November. And the NCD Alliance is now confirmed as the convener of NGOs for this pre-meeting, and as far as I know, the United Nations Office for South-South Cooperation will convene the UN system and the UN Interagency Task Force for NCDs. WHO has been in discussions with the World Economic Forum to convene private sector entities, as well as with the International Parliamentarian Union to convene parliamentarians, and I believe the Aga Khan Foundation to convene philanthropic foundations. And the objective of this pre-meeting is to bring together the different sectors by themselves to each develop a roadmap for joint advocacy to strengthen international cooperation on NCDs, as well as to formulate a very small, concise set of recommendations for concrete action as input into this meeting. And perhaps just a quick note on the importance of, or the rationale for the pre-meeting. So the WHO, the GCM mandate foresee as the only outcome of these dialogues a meeting report. So the GCM itself cannot come out with any other outcome of this meeting than a meeting report, and these meeting reports can really only be as strong as the recommendations made at the dialogue by by the participants, and therefore it's essential that all of the different participants go into the dialogue with very clear recommendations for the meeting report to reflect. And so please, everyone who's planning to come to the dialogue in November, save the date for the 29th of November. We'll send out invitations for this for the NGO pre-meeting in the coming weeks, but I already invite you to pencil in the date into your calendars. All right, that is it for me, and I'll hand back to Katie.
Thank you, Alena, and thank you, Jess, for those excellent presentations. We don't seem to have had any questions. I've just got one for you, Alena. Something that we didn't mention in the slides is the Ending Childhood Obesity Commission that WHO has been running over the last year or so, and I know that there's been some activity recently. Can you give a short update on any kind of key recent activities within the Commission on Obesity?
Yes, so the Commission has a meeting this week here in Geneva on Monday and Tuesday, and I'm afraid, as I wasn't in the room, I don't have any sort of hot updates. As you all know, the interim report was up for a public consultation during the month of May. The Alliance developed a submission in response. And so right now the working group is really basically finalizing their report to the WHO Director General. So we're very close to the end of this commission, and we should expect, I believe, the report is due to go to the DG in November, unless this has changed. So I'm afraid I can't give any sort of fresh updates from the meeting itself, but just so that you're aware that the Commission met this week, and we should be seeing the report fairly soon.
Great, thanks, Alena. I didn't mean to put you on the spot there. We've had a question from someone on the webinar. How do NGOs from Africa participate in the GCM dialogue that's coming up?
That is a good question. You can simply register through the registration form that is included on the slide on the dialogue. I think it's still up on the screen. It's the same process as for any NGOs. Obviously, there's unfortunately, I think, just a very limited amount of travel grants that the WHO provides, and usually these travel grants are also based on sort of an active speaker role. But if you're interested in attending the meeting, I would invite you to read up on the dialogue. There's quite an extensive. There's a lot of information on the website, on the WHO website, including the background documents. And then if you have any very specific question, I would recommend that you write directly to the GCM secretariat. But I personally would highly encourage you to attend the GCM to attend the dialogue. I think it would be very important to hear voices from the regional level and not just have global stakeholders in the room. I think that has been quite a significant disadvantage of the last dialogue. And it's really important that we have regional voices there, but also patient voices to emphasize the urgency of the issue, really. And especially given that we're talking about north-south, south-south cooperation, it would be a pity if we only had global stakeholders in the room.
Great, thanks, Alena. We've had a question around the Childhood Obesity Commission from Bryony. Is there a second consultation on the final report from the Commission? Do we know?
I hope I'm not saying something wrong, but I don't think there is. I may be wrong. I need to verify that. I can do that right after this call and let you know, but something tells me that there won't be another consultation. If anybody on this call can correct me or knows better, please do so.
Okay, great. So we'll verify that after the call to make sure that we're providing the right information. Just a quick question about the pre-meetings, Alena. Obviously, we've now got pre-meeting organised by the NCD Alliance for NGOs. We'll have one for the private sector, we'll have one for foundations, one for the UN, and one for parliamentarians, which would be a great way to kind of convene these different constituencies and get people prepared before going into the dialogue. But how are we going to make sure that those kind of pre-meetings are kind of consistent in their approaches, and that what's coming into the meeting for the actual official dialogue is somewhat consistent in that sense?
Mm-hmm. So WHO is working quite closely with each of the conveners. So for the NGOs, obviously us, and then for the private sector, I believe the World Economic Forum has now been confirmed. And they have very specific sort of guidance documents and even sort of a format that they wish to receive the recommendations in. So WHO is working with all of these different partners, and then I believe we'll also very soon probably engage among the different conveners to make sure that we're aligned on the plans, on the agenda, and the different agendas for the pre-meetings, and then also the plans for concrete input into the meeting. So it's quite streamlined, I would say, and I think, but it's quite important that there's consistency in how we approach these pre-meetings.
Okay, great. And obviously just let us know anyone in the network that's planning to go to that dialogue and that would like an invitation to the NGO pre-meeting, because as Alena said, that we'll be sending out the invitations in the coming weeks. Just one final question, Alena, then I'll leave you alone. With the GCM working group, so we've had the financing working group and the private sector working group this year, and as you say, they're soon to be developing and publishing their final reports. What can we expect next year with regards to GCM working groups?
So for the work plan of the GCM for 2016 and 2017 foresees 3 working groups, and 2 of them will be set up in the coming year. The first one will really look at integration of NCDs into HIV/AIDS, into the HIV/AIDS response, into maternal and child health, and other cross-cutting agendas. And the second one, you're asking me very difficult questions today. I think the second one is going to look further at this question of strengthening international cooperation on NCDs through North-South and South-South and triangular cooperation. And then there'll be one in 2017, and that will look more at health literacy and awareness raising and education.
Excellent, thanks. And I think with regard to the working groups for next year at the GCM, we're also aware of the process has now begun in terms of WHO headquarters inviting recommendations from their WHO regional offices on who the experts should be within those working groups. So I think that provides an interesting opportunity, as we did last time within the network, to think about who we want to be on those working groups, and then to be doing some outreach with specific member states to encourage them to put the names forward that we would want to see on those working groups. So more to follow on the GCM working groups for 2016. Okay, excellent. Well, I think we've come to the end of any questions that have been raised in the chat box, and just to say thank you very much to all the presenters who've presented today. As always, we will be sending around the slides via our e-alert, and we'll also be publishing them on our website. So if you haven't managed to listen in, or you're wanting to look at them again, please do download them at any point. And that's it for today, and look forward to seeing those of you that will be in New York for the UN General Assembly and the summit there in a few weeks. Thank you very much. Goodbye.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your lines.